welcome to another video. Today our topic is on diabetes. We will be covering certain aspects, starting off with what is diabetes, and then we'll move to symptoms and diagnosis, treatment, complications, and preventative measures. So let's get started. So diabetes is a chronic medical condition that affects the body's ability to produce or use insulin. Now insulin, as we all know, insulin is basically a hormone that regulates blood sugar levels. When someone has diabetes, what happens is that their body is unable to properly produce glucose, which can lead to high levels of sugar in the blood and a range of health problems. As we all know, there are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disease that occurs when the body's immune system attacks and destroys the cells in the pancreas that produce insulin. Type 1 diabetes is an autoimmune disease that occurs when the body's immune system attacks and destroys the cells in the pancreas that produce insulin. This results in a complete lack of insulin in the body. Type 1 diabetes typically develops in childhood or adolescence, but it can also occur at any age. The exact cause of type 1 diabetes is not known, but it is thought to be related to genetic and environmental factors. The second is type 2 diabetes. Type 2 diabetes is the most common form of diabetes and occurs when the body becomes resistant to the effects of insulin or does not produce enough insulin to maintain normal blood sugar levels. Type 2 diabetes typically develops in adulthood, but it is becoming increasingly common in children and adolescents due to the rising rates of obesity. Risk factors for type 2 diabetes include being overweight or obese, having a family history of diabetes, and being physically inactive. Both types of diabetes can lead to high blood sugar levels, which can cause a range of health problems over time. These can include nerve damage, kidney diseases, vision loss, cardiovascular disease, and more. It is important for people with diabetes to manage their blood sugar levels through a combination of medication, lifestyle changes, and regular medical care to prevent or delay the onset of complications. Coming to the symptoms and diagnosis of diabetes. The symptoms of diabetes can vary depending on the type of diabetes and the severity of the condition. However, some common symptoms are increased thirst and dry mouth, frequent urination, especially at night, increased hunger, fatigue and weakness, blurred vision, and unexplained weight loss. These symptoms can develop gradually over time, so it is important to be aware of them and seek medical attention if you are experiencing any of them. Diagnosis of diabetes typically involves a combination of physical exams, blood tests, and urine tests. A healthcare provider may order a fasting blood sugar test, which measures the amount of glucose in the blood after an overnight fast. If the results of this test are abnormal, additional tests may be done to confirm a diagnosis of diabetes. These tests may include an oral glucose tolerance test or a hemoglobin A1C test, which measures a person's average blood sugar levels over the past 2 to 3 months. It is important to note that some people with diabetes may not experience any symptoms initially, which is why regular checkups and screening tests are important for early detection and treatment. People with risk factors for diabetes, such as family history of the condition, obesity, or sedentary lifestyle, should talk to their healthcare provider about getting screened for diabetes. So the treatment and management of diabetes typically involves a combination of lifestyle changes, medication, and regular medical care. The goals of treatment are to control the blood sugar levels, prevent or delay the onset of complications, and improve overall quality of life. Lifestyle changes are an important factor of managing diabetes. These may include, first off, as we all know, following a healthy diet. Eating a balanced diet that is rich in fruits, vegetables, whole grains, and lean protein can help regulate blood sugar levels and promote overall health. Engaging in regular physical activity, exercise can help improve insulin sensitivity and lower blood sugar levels. It is recommended that people with diabetes aim for at least 150 minutes of moderate intensity aerobic exercise per week. Third is maintaining a healthy weight. Losing weight, if necessary, can help improve blood sugar control and reduce the risk of complications. In addition to lifestyle changes, medication can be prescribed to help control blood sugar levels. The type of medication prescribed will depend on the type of diabetes and the individual's specific health needs. Some common medications are metformin, a medication that helps to lower blood sugar levels by reducing glucose production in the liver, and insulin. Insulin, as we all know, a hormone that regulates blood sugar levels. People with type 1 diabetes typically require insulin therapy to survive, while people with type 2 diabetes may also require insulin therapy if other medications are not effective. Monitoring blood sugar levels is also an important part of managing diabetes. This can help people with diabetes understand how their lifestyle changes and medication are affecting their blood sugar levels and making adjustments as needed. People with diabetes may use a blood glucose meter to check their blood sugar levels throughout the day. Overall, managing diabetes requires a commitment to making healthy lifestyle choices, taking medication as prescribed, and working closely with a healthcare provider to monitor blood sugar levels and manage any potential complications. Diabetes can lead to a range of complications that affect different parts of the body. These complications can develop gradually over time, and they can be serious and life-threatening if left untreated. First is neuropathy. Diabetes can cause nerve damage, which can lead to symptoms such as tingling, numbness, and pain in the hands and feet. This can also lead to problems with digestion, sexual function, and balance. Next is retinopathy. High blood sugar levels can damage the blood vessels in the eyes, leading to vision loss or blindness. Third is nephropathy. Diabetes can damage the kidneys, leading to kidney failure and the need for dialysis or a kidney transplant. Cardiovascular diseases. Diabetes increases the risk of developing heart diseases, stroke, and other cardiovascular problems. Preventing or managing these complications requires careful management of blood sugar levels and regular medical care. For instance, keep blood sugar levels in a healthy range. This can be achieved through a combination of medication, lifestyle changes, and regular monitoring. Have regular medical checkups. Regular checkups with a healthcare provider can help detect any potential complications early and provide appropriate treatment. Overall, preventing or managing complications requires a comprehensive approach to diabetes management, which includes medication, lifestyle changes, and regular medical care. It is important for people with diabetes to work closely with their healthcare provider to develop a personalized treatment plan that takes into account their specific health needs and goals. To summarize everything that has been stated so far, diabetes can be managed through lifestyle changes, medication, and regular medical care. By making healthy choices and working with a healthcare provider, people with diabetes can prevent complications, improve their health, and lead a full life. Prevention is key, so make small changes to your diet and exercise habits to reduce the risk of developing type 2 diabetes. Take care of your health, be proactive, and consult with your healthcare provider for any concerns about diabetes. Thank you for watching, and I'll catch you in the next video.